Today's topic is how to study for USMLE, how to study for exams. I'm a physician from Bombay, did my MD and DM in nephrology from there, subsequently wanted to come to US, had to study USMLE and crack it to get entry to the system here. And I've been a practicing physician here. I've been an attending physician. I was a resident earlier, became attending physician, was in teaching, was on faculty at a lot of teaching institutions, was an interviewer for residency programs, and have selected a lot of FMGs, guided and mentored a lot of medical students and medical graduates to accomplish well. So, studying for USMLE is the key to success because your attempts on USMLE Step 1, Step 2 and your scores on USMLE Step 2 is the most important, is the game changer, right? So I would tell you 5 points that you got to remember. Number 1 is strategy. Strategy. Now, always time is of key. You have a choice or to give the exam at a month or 2 months notice, or you have a choice to give the exam at 3 months, 4 months, 5 months, 6 months notice. Always choose a greater time period because number 1, your anxiety and stress is less. You can study over a prolonged period of time and score well. Remember, these exams are not just a formality. My father and mother, my माँ बाप ने बोला है तो मैं ले लेता हूँ, या my friends are taking so I should also take. No, it's not a formality thing. It's a passion. It's a dedication. You want to do it. That is why you are doing it. So some people say, I just want to take a shot at it. No, be convinced that you are going to do it. So keep enough time, anywhere from 3 to 6 months for each part. Now, that is number 1. Number 2 is a little bit every day over a longer period of time. Meaning, there are 2 people. One has 6 months time to prepare for the exam, and he studies even pace, steady, 2 to 3 hours a day. The other guy has only 2 months to prepare for the exam. Number 1, he's heightened with anxiety, and number 2, he is putting in more time, 5 to 6 hours a day. But if you calculate 6 months, 3 hours a day is 540 hours. 2 months, anxiety level is high. 5 hours per day you are putting in. You're just putting in total of 300 hours. 300 hours, 540 hours. Anxiety here. So you see the difference, okay? So that is number 2. Number 3 is, I would say, do a hybrid, meaning a longer period of time for studying, for taking the test, and just 1 month before, go all out. Meaning, instead of putting 2-3 hours a day, put in 8 to 10 hours a day. So that's a hybrid model, meaning over a longer period of time, 5 months, do 2, 3, 4 hours a day. In the last month, do 8 to 10 hours a day. Okay, I've studied even for 14 to 15 hours when I was doing my DM in nephrology. So that apart. So those are the 3 points. 4th point, form a study group, meaning collect 1 or 2 or 3 people, bounce off ideas. Hey, this is good there. Hey, this is good here. This is a good group of questions. Discuss. Once you discuss something and you teach something to others, it becomes a rock solid thing for you. So studies have been done which say that students who are studying in groups, their performance is much better. Their outcomes are much better. This is a Stanford study. So study groups. Number 5, do as many questions as possible. 10,000 to 15,000. Now I've seen students who do 2,500 UWorld questions. They will keep on doing that again and again, same thing, keep on reviewing. No, you will not get anywhere. You will not score well. Do 10,000 questions from different sources. UWorld, MBOS, Boards and Beyond, CMS, NBME, wherever you can lay your hands on. So different sources. Take notes on key points, okay? Prepare your key points, your own book in which you jot down the important points. Review those notes every week or every 2 weeks. Set aside 4 hours, 5 hours, review all of them. Repetition helps you. Studies have proven repeating Repeated recalling helps you perform better. Take practice tests towards the end. Track your progress by taking tests. So you take NBME 1, you score 40%. After 2 weeks of 8 hours a day, you take another test, you score 55%. So that tracks you. That gives you an idea how you are progressing. Now, you are doing A plus B to get C plus D result. If your result is C plus D, that means you, despite doing whatever you are doing, you're scoring 40%. That means your A and B are wrong. You got to do something different to get a different result. Okay, these are the 5 very important points. Now, the sixth point I want to tell you, step 1 is pass and fail. 2 months, 3 months, knock it off. Don't try to, no attempts on any of the tests. Step 2 is the most important. Scores in that are the most important. That is what will get you into a residency program, right? Study for at least 3 to 5 months. Dedicated study, rock solid number of hours. 6 to 8 months, you should be done with both, and you will be in a residency program in US. Good luck. Follow me on LinkedIn or Instagram, and Dr. Izhar, Izhar. Follow me on Instagram and LinkedIn. Send me a message. I'll be happy to help you and guide you and give you my skills and knowledge and experience so that you can be successful.